Well, if you're in your 20s or 30s and want to prevent some of the things that your older counterparts are experiencing now in their 40s and 50s, then you need to watch this video. Make sure you like and subscribe below if you like this content. Hi everyone, I'm Dr. Mara Weinstein. I'm a board certified dermatologist, and today we're going to go over all the things that you wish you would have done in your 20s and 30s if you're in your 40s and 50s now. So looking back, there are essential things that you need to do to keep your skin and your body in tip-top shape in your 20s and 30s so that when you get older, you're not catching up or having to reverse the results of some bad habits. So first things first, little did you know, but as early as age 26, we stop producing collagen. Why is that important? So collagen is what helps our skin looking plump, youthful, hydrated. There are cells in the dermal layer of our skin called fibroblasts, which help promote the development of collagen, elastin, and hyaluronic acid. These three ingredients together keep our skin youthful, hydrated, glowy, and also give our skin that bounce back so it doesn't start sagging and forming fine lines and wrinkles. So the goal in our 20s, knowing that we stop producing as much collagen, is to really kickstart that process of collagen stimulation. Don't let our fibroblasts fall asleep, and use a product like retinols. So Retin-A or tretinoin is really like the liquid gold when it comes to anti-aging. You might have heard of it. It might have been prescribed when you're a teenager for acne because it's really good at drying up sebaceous glands or oil glands, but it also helps with cell turnover and prevents the development of brown spots, fine lines, and wrinkling, especially prematurely. So there are a lot of different types of retinols. Retinol is an over-the-counter product that you can purchase. It tends to be less irritating, easier to use on a nightly basis, and it's definitely a good way to get started. As a dermatologist, we prefer to start patients on tretinoin or Retin-A, which is the active version of retinoic acid. Now, this is going to be a little more irritating and a little difficult to get started, but once you're on it, I can tell you that I've seen patients who've started in their late 20s and now they're in their 60s, 70s, and their skin still looks amazing. And you can tell right away that they've been retinol users for life. So it's important to find a retinol or a retinoid that works for you. Once you find something, stick to it. And if you want to get better results or try something different, talk to your dermatologist, but definitely start a retinol in your late 20s. The next thing you can do in the spirit of prejuvenation and prevention, you'll thank your older self, you'll save a ton of money, and that is doing preventative Botox. I know this is highly controversial, but it is worth it. If you look at your mom or your aunt or someone in the family and they've developed frown lines, especially in the mid-face and the glabellar area, this is entirely preventable with early Botox. Now, I specifically talk about frown lines because it's a negative emotion. Because when you frown, you're creating a negative emotion, and nobody wants to have that look of negativity stuck to their face. I hear all the time from patients that people say I look angry, but I'm actually happy. And that perception of anger comes from those etched lines in the skin right in the middle of your face, which comes from years of frowning, scowling, and potentially being angry. Now, it can also come from squinting, which if that's the case, you need to wear sunglasses and have better sun protection. But if it's coming from frowning, scowling, and an angry emotion, then you definitely can prevent that early on. Preventative Botox really in small amounts shouldn't have any negative effects. There are patients who've been getting Botox from their 20s all the way up to their 80s, and they're doing just fine. The one thing that you do hear about, the potential to develop antibodies against the Botox, which means that it doesn't work as well. Nowadays, there are many different formulations, so I suggest that you talk to your dermatologist about which formula is right for you and which one you should get started on. Often when you start neuromodulators like Botox early, you don't need as high of dosing, and you also don't need to be treated as often because, as you might remember, muscles have memory. So once you knock out the memory of creating that negative expression, over time you probably just won't do it, which means that you won't need as much later on. But I can tell you the flip side of that is trying to reverse deeply etched lines on the forehead and the frown area, and it is very difficult. I'm not saying that you need to get Botox all over your face, around your eyes, forehead, anything like that. I'm just suggesting that early on you think about perhaps doing a little Botox in this frown area, which is a negative emotion, which makes people look angry when they're actually happy later on. Next, in your 20s and 30s, this is a time where people are starting to bear children. And obviously with pregnancy, there's a lot to think about. So your body's changing, your blood volume doubles, but in terms of your skin, it can be a time where your skin is really prone to pigment. There's a condition called melasma, or the mask of pregnancy. And often pregnant women are so focused on everything else, which makes sense, that they forget to take care of their skin. Simple things like wearing sunscreen can prevent that mask of pregnancy from getting worse. The goal is to prevent that pigment from coming up so that post-pregnancy you're not dealing with reversing it. Melasma can be a really tricky condition to treat, and there are ways to prevent it, and that first step is by wearing sunscreen. Now, when you're pregnant, you're going to want to wear sunscreen that's mineral-based, so titanium oxide and zinc dioxide, and also that has a tint to it. Tinted sunscreens help prevent pigment from forming on the skin because they can block visible light and other aggressors that you might not be aware of, more than just UVA and UVB rays. So wearing sunscreen while you're pregnant can prevent that pigment production from conditions like melasma. Staying with the pregnancy theme, this is something that you probably remember your mom telling you or you hear about, but it is so true that you should be wearing compression hose, compression stocking, compression leggings, something that compresses your legs when you're pregnant. Like I said, blood volume doubles when you're pregnant, and so this is a time where you're very prone to developing things like spider veins, varicose veins in the legs, just because you have all that upper body weight in your core. And if you're somebody who sits a lot at the desk for work, or you don't get a chance to exercise as often as you'd like, which is common with pregnancy, you can develop spider veins. And again, this is something that is preventable, but when it occurs, it's difficult to get rid of. Treatment for spider veins involves injection. So we inject a sclerosant like polydocanol to help collapse the vessels that are superficially located on the skin on the legs. But sometimes the development of spider veins actually starts from leaky valves, which comes with varicosities or varicose veins. So it is a bit of a process, and it's a little tricky to reverse. So again, if you start wearing compression stockings, compression hose, compression leggings when you're pregnant, you're doing yourself a favor to prevent the development of these spider veins later on. You're doing yourself a huge favor so you can prevent the process of treating and reversing spider veins later on. Lastly, along with the pregnancy theme, don't stop your prenatal vitamins. I know it can be really difficult to take prenatal vitamins. Often they cause stomach upset, and they just are not something that you want to be on forever. But I would recommend taking your prenatal vitamins for up to 3 months post-pregnancy. That's because this is a time where your body's hormones are still adjusting, going back to normal. You might be nursing, you might not have gotten your period back. There's a lot of things going on in your body, so consistency is very helpful, especially when it comes to hair. So post-pregnancy hair loss and hair shedding is a thing, and it typically occurs about 3 months after pregnancy, and this is due to the shift in hormones. There could also be a little bit of stress involved, but mainly due to the hormonal shift. If you've been following and watching my videos, we talk about hair loss a lot, and you know there are so many other things involved, including hormones, nutrients, stress, diet, all of these things. So if you can maintain those prenatal vitamins, which have iron and vitamins in them, you can at least help maintain the density of your hair and ensure that if you do shed, the phase won't last as long and you'll be able to recover some of the hair loss more quickly. Lastly, eye cream. Eye cream is one of those things that's highly controversial. A lot of dermatologists and estheticians will say you don't need eye cream, but I truly believe it's important to start eye cream early, and I'll tell you why. There's a few reasons. So eye creams are specifically formulated and tested to be safe and gentle to use around the eyes. Often other facial creams and serums are not necessarily tested around the eye area. Now, it doesn't take a rocket scientist to figure out that the skin on your face is distinctly different from the skin under your eye. The skin under your eye is thinner, it can become more crepey faster, it can have pigmentary and volume issues more quickly, and so it's really important to take that extra step to nourish the skin around your eye. Eye creams come in lots of different formulas. There are eye creams for puffiness, for pigment, for aging. I would find one that has the ingredients in it that will address the concerns that you're having, but if you don't have any issues at this moment with your eyes and you're in your late 20s, early 30s, just find an eye cream that's hydrating, something with hyaluronic acid and ceramides. Find something that you will use every day that's not irritating to just gently pat around your eyes. So when you're in your 30s and 40s, you're not dealing with volume loss and crepey skin around your eyes, and you've done your due diligence to protect the skin around the eyes just as well as you did for your face and neck. If you like this content, you have any questions, please drop them in the comments below. So make sure you like and subscribe for all things dermatology, skincare, aesthetics, and overall health and wellness, feeling like your best self always. Thanks so much for watching.